Osteoporosis prevention.
Did you know that osteoporosis is 8 times more common in women than in men? 1 in 2 women over age 50 will have an osteoporosis-related fracture in her lifetime. The literal meaning of osteoporosis is porous bone. It is medically defined as a chronic, progressive metabolic bone disease characterized by porous bones. It is the gradual and continual loss of bone mass and structural deterioration of bone tissue.
The Osteoporosis Objective for Healthy People 2020 tracked bone mineral density as a measure of major risk factor for fractures. The goal of Healthy People 2020 is to prevent the illness and disability from osteoporosis. Who is most at risk for osteoporosis? Some of the most common risk factors are women, age, family history, ethnicity, early menopause, alcohol, cigarette smoking, deficiency in calcium and vitamin D, low estrogen, and corticosteroid use. Where in the body does osteoporosis affect? Osteoporosis commonly affects the bones in the spine, wrist, and hips. Signs and symptoms indicating the start of osteoporosis includes back pain or spontaneous fractures.
The FRAX tool can be used to guide treatment decisions in people who meet the following 3 conditions: postmenopausal women or men age 50 and older, people with low bone density, people who have not taken osteoporosis medicine. The FRAX tool uses information about your bone density and other risk factors for breaking a bone to estimate your 10-year fracture risk. Your FRAX score estimates your chance of breaking a hip as well as your combined chance of breaking a hip or other major bones over the next 10 years. Major bones include the spine, hip, forearm, and shoulder.
Let's talk about prevention.
Maintaining a healthy body weight and diet is important to prevent osteoporosis. Calcium is a principal mineral that slows bone reabsorption and conserves bone mass. You also want to include vitamin C, potassium, vitamin D, fruits, vegetables, protein, and low-fat dairy products. Weight-bearing activities, resistance training, aerobic activities, and balance exercises increase bone quality and strength, reduce pain, increases energy, and increases the quality of life. You should have 30 to 60 minutes of a combination of weight-bearing and resistance training. Endurance weights should be 3 to 5 times a week, resistance training should be 2 to 3 times a week, and then you should incorporate balance training like Tai Chi or postural gait training.
Nursing roles. Assessment. Obtain a history of risk factors of osteoporosis, fractures, and other musculoskeletal disease. Assess risk for falls and fractures, sensory or motor problems, improper footwear, lack of knowledge of safety precautions. Nursing diagnoses could be chronic pain, impaired physical mobility, risk for falls and injuries, activity intolerance. Planning. Teach the value of walking daily throughout life to promote strong bone remodeling. Provide dietary education in relation to adequate daily intake of calcium. Encourage use of combined calcium and vitamin D replacement. Also encourage young women at risk to maximize bone mass through nutrition and exercise. Suggest that premenopausal women confer with their doctor about needing calcium and estrogen therapy. Alert patients to resources like the National Osteoporosis Foundation. Interventions. Assist with putting on back brace and ensure proper fit. Encourage compliance with physical therapy appointments and practicing exercises at home to increase muscle strength surrounding bones and to relieve pain. Evaluation. A desired outcome would be to increase activity tolerance and increase bone density.
Management of osteoporosis. Non-pharmaceutical options would be applying heat or cold, transcutaneous electric nerve stimulation, acupuncture, massage, physical activity, relaxation techniques, and physical therapy. Management with medications and supplements would include calcitonin, estrogen, and hormone therapies. Supplements of adequate intake of calcium, and adequate intake of vitamin D. A bone density test is the only test that can diagnose osteoporosis before a broken bone occurs. This test helps to estimate the density of your bones and your chance of breaking a bone. Laboratory tests include blood calcium levels, thyroid function tests, testosterone levels for men, and other blood and urine tests.